Facebook Live, please let me know so we can start right away. Thank you very much. Okay, guys, if you believe you are on the Facebook and we are live there, please let me know. Yes, seems like we are on the Facebook and we are live right now because I see. No, we are not yet. Please, guys, if you can see me on the Facebook and if you are live there, please, guys, let me know. Okay, that is great then. Maybe we are live right now there because I see Dr. Rana. Hi, Dr. Rana, how you going? Dr. Fatima, how you going? Dr. Sahifa, how you going? And then Dr. Jailan, how you going, Dr. Jailan? Dr. Abu Somia, how you going? And then Dr. Sajrati, Dr. Tanvir, Dr. Samiha, Dr. Rahman, which is same name like mine, and Dr. Sanpreet, and Dr. Natal, and every one of you guys. Okay, now, look, this is not a warning, but this is actually, let's say, it's a small notice in the beginning. This session will be a little bit lengthy session. By the way, please, or our admins, if possible, just send the link for the Facebook group for our Facebook page, so the candidates can actually join there, and then they can ask questions if they like to ask questions, guys. So now it's your own preference right now. If wanted to be on Zoom, just only to listen to me, that will be enough. But if you have questions, if you want to communicate with me or interact with me, please, guys, the admins on the Facebook, sorry, on Zoom right now will give you the Facebook live link. Just click on it, and then you can communicate with me. Now, before I start, I would love to check on every one of you, and I wish every one of you will have the best ever life, success, happiness, and health. ADC exam is just a part of our life, but it's not the whole life. We really still need to care about the family, about ourselves, and to care about the people around us as well. To say this, ADC exam, especially for part 1, still, it's a big dream. We actually should work for it on the right way to achieve this dream and this goal, and to pass both part 1 and part 2 exam, and then you get your registration, and then you'll be famous, a rich dentist, get new cars. But please, guys, new wife and no new husbands, because that's what I have seen. Some of the candidates, after they pass the exam, they get new stuff, but hopefully know the family. Let me share my screen first. Give me 1 second, please. Okay, as I mentioned before, guys, you may expect up to 2-hour session. I'm trying to do my best to make it shorter than this, but I cannot promise. Guys, can you see my screen right now, please? The champions on the Facebook. If just let me know if you can see the screen or not, will be great. Hi, Dr. Shumaila. Hi, Dr. Samia. Yes, you can. That's great then. You like this, Dr. Runner, right? And Dr. Ashnit, you like it too, right? That's okay. Okay. Doctor, you see, I love this. You see, guys, questions, showering questions in the beginning of the session. I love it. Now, um, Dr. Olhak, just asking question, Dr. Bido, I heard that ADA has released a new TG edition. Can you please confirm if it's correct and share some details about it? Okay. So far as I know, there is no any new TG has published, or we haven't received any new TG version in our clinics. Because once ADA released any version of TG, straight away, second day, or maybe even before they announce it, we get the new version straight away into our clinics. Now, I don't believe at all there is any new TG has been released yet. However, hasn't been released yet. However, there is a little bit of changes happening, adding some topics on the electronic version, but not necessary to be a new version. So what we need to do right now is, as it has happened in the past, people actually used, guys, I'm telling you about the past, what has happened. Once we got in 2019, we got the third version, the current version right now. And you know how people really, they run behind anything new. Once you say the word new, every person runs behind it. And then what has happened at that time is people bought that book, which is Therapeutic Guidelines version 2019, and they read from it. It was a little bit lengthy. And unfortunately, the exam came from the old version, which is version 2. And that's why I told at that time to my champions, guys, don't actually get concerned or misled by the new version at this stage, because once the exam be related to the third version or the newest version, EDCs themselves, they should mention it in their website. Just to make you happy right now, just relax. EDC, they will announce for you. Don't take any further step. Clear this question right now? And please, even it has been released, don't read it unless ADC they say in the website that the exam will be from the new version. Okay? Don't do the same mistakes like the candidates did the last times. Now, I hope, guys, my screen is visible to everyone. I'm not quite sure, guys, if my screen is visible or not. Because when I look at it by myself, it's not visible. I don't know why. It's just as if me only talk. Okay, back again. Yes, I can see it's visible right now. That is great then. Okay, let's start. Today, we're going to discuss more about March 26 patch. And this patch, actually, for me, it's number 121 batch. What does it mean? It means I did at least 121 course for ADC part 1. And this was only online courses, because I used to do this on site as well in the past. So I love to be here, guys. I'm very excited. It's a part of my life. Imagine 15 years of my life. I am addicted to this. It's more like an addiction right now for me. And definitely, I know how big is this journey for every one of you. So this is actually here the rest support for ADC Part 1 exam. What we're going to discuss today, we're going first to tell you how special you are, guys, to me and to us as an academy. And this will be shown in these slides. By the way, in these slides will not be only helpful for our candidates, will be helpful for everyone else, including the candidate not taking courses, or even the candidates they actually planning to take courses. Once we talk about the candidates, we call them our champions. In this session, I believe we have two types of champions. New champions, completely new, exactly as if it's the first time to you ever to go into a new country or a new home or a new house. You don't actually understand what's happening in this place. And there are some here which are their senior champions. And senior champions, I believe, they are our champions who started this course a little bit early, being really taking a lead, and they started from or with September 2025, which is the last course. Guys, who's senior champion today? I believe we have at least like 5 or 10 or maybe even more champions attending this session, and they are seniors. They actually been a part of September course. Now, new champions. I'm going to give you a little bit of instructions or a little bit of an introduction about who we are. Will not be really a long one, but just a quick one, because most probably you are now confused how to start the journey. Should you take a course or not? And if you take a course, with who you should take the course. So this is going to be a brief in 5 minutes. And then after this, we're going to discuss about study materials, the plans, the classes, the best way to study for this exam. And as I said, this information not only for our candidates will be helpful for everyone else. As you see right now, the candidates call me the father of ADC exam tutors. Why this? For this reason. 1, I am the only registered Australian dentist with 15 years of ADC tutoring experience in Australia. There is no one can claim this title. Definitely, except our champions to use it. 15 years of experience means a lot for me. I learned a lot throughout this journey and this process. We actually have more than, I believe, 5,000 ADC Part 1 pass results in the last 15 years. Our groups, we are the first people ever had Facebook Part 1 group and Part 2 Facebook group and all other multimedia and the other platforms. And then the first people start to teach, it was about 6 to 7 years after me. That's why I've been known as the father of EDC tutors. There are lots of other things. I don't want to really talk about it for now because we need to jump to the other things. Again, we are the first academy ever, on-site academy, apart from, I believe, OTC in Melbourne, and it was one more academy in Melbourne that was ADA, and both of them being running by the government at that time, I believe, or mostly OTC. But I was the first dentist who just take the lead to teach EDC candidates. And that's why, being the first person, everyone started, or mostly everyone started EDC journey, even the tutors right now, they've been a part of my groups or my page or directly took the course from me. So I'm the founder of Australian Dental Academy in Melbourne. This is Academy for part 2 and part 1. And by the way, was the first person ever to have 2 academies in 2 states. And then the founder of Australian Dental Academy in Sydney. Now, guys, if you look at these 2 apples, let's give them numbers. This apple number 1. Let me change the color because it seems like the color really not very good here. Oh, this is number 1. I just delete it. And these 2. Which one is real? Which one is not real? Look, guys, sorry if you have a long day and you cannot look at the photo properly. Just try to do your best. Number 1 is real. I love this. You know what? Number 1 is us. Our champions, our team. For these reasons. 1, our champions, not just the leader of the March 2025, having about 200 champions passing the exam in March all over the time. And you know what? Easily, you can check this. Just open my group, my page, and anyone else in this live. You know what? Choose wherever you want. Just go back for the last 10, 15 years. Right? Definitely for the last 15 years, you can also check the stuff nicely. Compare, if you like. Check our candidates, our reviews. Check if anyone had the progress of our champions. That's why we're always lucky to have you guys, everyone here. We're lucky to have you because we know you're very smart. And this is our experience with every one of you. In the last patch, 119, 120 patch, was in 117, 118 patches. And then the previous patch has been very smart. And that's why we have always the highest number. We are the gold standard in Australia because we teach from inside Australia. We understand the guidelines very well. Exactly like this. You may think both of them apple because both of them look red in color. Somehow they're round in shape. And then you may think they're both apple, but actually they are not apples. One of them is real, the other one's fake. We create the new ideas and others just follow. Believe me, easily you can check this. So you are now, for our champions, you are now in the right place. Just only what I want you to do is do your best effort. And believe me, you will be perfect at the end. Now, what's our new ideas? Again, go and check this from all other platforms. We are the first people ever started to do mock exams, the online mocks. Go and check. Open all the pages, see which page, which academy has provided the first online mock for a long time, slowly, alone by themselves. And then the people, they find out, oh yeah, why not? Let's do online mock for the candidates as well. We are the first ever academy launched an ADC Part 1, Part 2 apps, alpha apps. Again, go and check this by yourself. I'm not saying things which, if I'm wrong, you can prove the opposite way from the other groups. You remember, if anyone been here about 2 years ago, everyone used to use Zoom only for sessions. We are the only people who started actually to move to Facebook. And we actually took this risk on ourselves. And we moved also to Facebook. And everyone followed us after this. We are the first people ever said there is no any more textbooks. And then we shifted to some journals. And then I found, no, I have a really big dream. I want to help all our champions because they don't have enough time to study and read. We really need something very concise and very interesting. That's why I used to say the word enjoy. Everyone now uses this word. The word concepts, they use it. Everyone now, once I shift from textbooks, everyone now shifted to journals. After I stopped journals, I said there is video bytes. Everyone now say notes. And they've been against us in the beginning. All my candidates, the older people here about 2 years, 3 years ago, they actually know about this stuff. So what I'm saying is, guys, you don't need to study textbooks anymore. Because I believe in my video bytes, my notes, my cakes, my diamonds. However, still it's your choice to read as much as I can from textbooks or from any journals or any policies. Yes, most of the tutors, they were once our students. That's why we always have the champions, leaders, and pioneers in this journey. After 10 years, I'm telling you, after you become very famous dentist, you have your own clinics here in Australia, you will find me still here teaching new dentists to get their own registration. And definitely I will meet you somewhere, either in Melbourne or in Sydney or Queensland, in Brisbane, anywhere, and then I will remind you of that days. It happens. It happens. You know what? I've been teaching candidates. Before they get married, they got pregnant during the course, they have kids, baby. This baby now, same height like me. What I'm saying is, we still remember all these memories. You will be one of these. Now, let's talk about the full comprehensive course. This part, it will be very helpful for our candidates who joined the course already. And will be also helpful for the people they just started the journey right now. Who's guys a beginner? Any one of you guys a beginner? Who doesn't know that much about EDC at all? Just started from today or a few days ago? Someone who just starting fresh with no any advanced knowledge? If you are one of these, I'm telling you, that's okay. Because the way we made the course is actually very easy to follow. And we start from scratch. I'm going to show you all the stuff. It will be very friendly because this is what I love about dentistry. For me, dentistry is something very simple. It's not really complicated or hard at all. ADC exam, in the beginning, maybe when I was students one time like you, or candidates at any time in school, I may found the answer a little bit hard, but that stage right now, it's not. At this stage, I see the answer, it's just very easy, enjoyable, has love in it. And you will know this once we start the course. The course itself is very intensive. It's for 6-month course. And by the way, you're going to have lots of revision. Like the last, if you ask the champions, they went exam in September. And by the way, we had one session for experience session. I hope every one of you guys listen to this. Maybe the link can be sent to you to listen to it if they listen to it. I have insisted to finish the course early and to revise the course. I believe it was for about 3 times revision for the last day of the exam. Even I was telling them, you know what? If ADC change their mind tomorrow and they said the exam is to be in 3rd September or 2nd, 3rd September, it will be maybe in 10th September, I will still provide you with study materials. Not study materials, but revision materials. And that's what I love about my champions, about myself. At the last moment, we all work nicely with big heart and motivation. We definitely gonna cover all the concepts. The candidates may have some doubts. Is it really enough to study only your stuff, Dr. Adam, and this question been asked in since 2011, 2012? Is this, and definitely that's as a valid concern to any one of you, because you need to ensure you're doing the right thing or not. And my answer is yes. And yes, once they finish the exam, they say, you know what, Dr. Adam? We feel like the other person has made the exam, and since long time this happening. Because with all experience, you can easily tell what's going to happen. And we only discuss the exam relevant topics. In the past, before 2019, I believe what I used to do is, we used to teach you from textbooks like Carranza for Perio, and then we found that's really very hard. And then after this, we say, let's focus on the relevant topics, the things for general dentistry in Australia, the things that everyone really needs. And that's what we do right now. Clear and simple notes. And this is going to be the next point. Look, guys, as I said always, this is just the sum of our help. The study plan, we're going to give you compromised, personalized study plans. By the way, look at this. This is one of the new things. If you have heard me saying this before, I believe it would be a good idea if you hear it now. I discussed with the team, with everyone, and the admin, to really help the candidates and find out what things can make it really different, to improve them and work directly on every single candidate's issue and the concern. We ended up to find out the best way is to give at least 1 hour. And by the way, guys, it's something new. 1 hour personalized session to every candidate per week. After we finish the task in a week, we discuss with the candidates about their progress. And will be personalized, only one-to-one, one-on-one. And then we discuss with us about anything in the life, a fight with husband, a fight with kids, anything. And then work issues, if you can help them with anything, finance, anything. They progress about NOC, The clusters, they pass cluster 1, but not cluster 2. What is the issue for cluster 2? How to fix the stuff? They couldn't finish the plan. So what exactly we can help them with? So this is new thing. And I believe that's going to be the best to our candidates to improve a lot, and they can score between 90 to 100%, because this is actually our aim right now, our goal, to make our candidates the best ever, the top on anyone else. We need them to score 100%. Yes, I have nothing called impossible in my life. Yes, I may have some troubles, some issues, some obstacles, but finally, there is nothing called impossible. That's what I've learned in my life. It will be structured daily study plans. I'm going to show you all the stuff. Google Drive. We're going to go with 200 and more of ADA and Australian resources. Definitely, guys, our Telegram will have 24/7 tutors access. And you know what? Very beautiful Telegram group, always active. We're always there and help you at any time. Definitely, we're going to go through robotic guidelines and all the stuff. The mocks. You know what? I believe you can read the stuff in your own. Read it, guys, because we're going to explain some of them, but let's focus on some points here. Video technique. The exam is a system. Not just, I'm telling you this because it's something going to help you the most. Guys, any one of you guys has attended the video technique with me? Yes, Dr. Rana, very good. No problem, Dr. Ashneet, at all. Great. Okay. Dr. Walisha, that's okay. Dr. Harpreet did this, but not you. You're going to go through biotechnique. What's biotechnique? Biotechnique, guys, it's technique teach you how to answer the questions, even if you're not a dentist. Imagine, definitely, I'm not saying this to not study. I'm saying this to tell you, ADC exam is more like a system. Even if you study, and you study very hard, you still really need to understand the system. And this biotechnique is going to tell you how to answer the questions when you are confused. Definitely, we're going to go through TG and ODIL and all the journals. We're going to give golden hours for everyone. By the way, I'm going to discuss with you more about the new stuff we're going to do for you this course. It's here. But not now. The surprises, we call it. Let's start. You may have heard about our course schedule. Our course has taken consideration most of your circumstances, including you may be away from dentistry for a long time. And we understand this being Australia. You come here in the beginning to settle down with your family. You may get away from dentistry for more than 2-3 years, doing other things, and then you start to think about your registration. Same exactly. If you have been graduated in the last 5-10 years, you may feel that you are away from dentistry. So I'm telling you, don't worry. We're going to hold your hand. What we call it as a scratch stage, warming up stage. Let's check this. If you joined our course, you will take this. Guys, can you see my Google Drive? Let me check on the Facebook. Wow, thank you, Dr. D. Tamish. Guys, Dr. D. Tamish, he was, look, he's very smart. You can see that there are candidates, I can remember them by names, because mostly I remember my candidates, but there are special candidates. They've been attending every single session. They've been actually very interactive. I still can remember them personally, exactly like Dr. D. Tamish. He did exam in September, right? And I love to say hi to him. Thank you, Dr. D. Tamish, saying this. Now, let's, guys, discuss more about the course itself and what things we're going to cover in this course and the benefit of each. As you see right now, we start with warming up stage. And then the scratch stage. Scratch stage is TG tasks. By the way, I ask you guys in our Facebook group, please ensure you are in our Facebook group, part 1 group, the pediatrics group, because I ask question there, and there is about 100 candidates interested to join these sessions about TG. If you haven't left your name, you will not be a part out of it. So it's free things, no fee things. It will help you. It's a part of the course. It's separate help. I used to do it all the time, and now everyone follow me in this. Everyone now happy to help the candidates for free, which I used to do it in the last 15 years. Now, ensure, guys, you comment there on this link, or actually the post I give it to you there, to be a part of the TG scratch. So we're going to start with TG or warming up stage, either way. Now, if you look at it right now, let's open the first TG. Actually, let's go through the stages. We did the course in different stages. And by the way, it's the course is ready. You know what? I can just add you into the stages, and I'm telling you, the course is ready. Take it. That's what we're going to do for the whole year, with the plans and everything. But because I used to do this in the past, I used to see the people, they actually very frustrated when they see all the study materials in one go, even with a good plan. And that's why we actually give you one stage by time. Enough to finish the small periods, about a week or 2 weeks, and then giving this to you. My course always is a dynamic course. What does it mean? It does need me to every night to think about what really part of the course I must improve or add on. Instead, I just copy paste the stuff, give it to you, and say, that's a course, let's do some session about it every week, and that's it. Now, let's start with the TG task. As you see right now in TG task, we divided the whole book topics into 3 main tasks. First TG task, second TG task, third TG task, and then, because that's the first thing, we're going to provide you what we call it as some recordings. And these recordings, by the way, do you want a new surprise as well? Let me give you a big surprise. All our sessions right now, even including secretive sessions, it's up to you guys. Because before I used to keep the secretive sessions because I knew from the past people attended our session to take my answers and they change their own answers. So that's why I kept my session, the last sessions, always private with all secretive information, secretive answers, so no one can join the course and then take these questions and these answers and then share it with their own candidates. But now, I believe I don't care about this anymore. If you are happy to get all of these sessions, it's up to you. I always love to discuss with you. If you want all the sessions be recorded, we're gonna do it this time. Please, guys, tell me on the Facebook. Would you like to make it secretive or to record everything? Our decision at this stage, we're gonna record everything. Okay. Let's say you started the course with us, like for next week. Actually, today is the first, but the first task will be, today is Wednesday. First task will be from tomorrow, Thursday, right? And then you're gonna go through all this stuff. We're gonna give you the plans and everything. We're gonna add you to here. Let me check, guys. Okay. The first TG task, we provide you with daily plan. Guys, I'm still connected? Because actually, I think I dropped for a few seconds, few minutes. No problem. We're going to record then. Please, guys, if I'm still connected, let me know because I cannot see this. Yes, thank you, Dr. Natalie, for saying yes. I hope I'm connected. Thank you. Okay, Dr. Saifa. Now, TG. We're going to give you the study plan in TG. I think, let me check this. We need to just pause here. Upload. Update this. I hope, guys, I'm still connected and you can hear me. Okay. So in TG, what we do is we're going to give you the plan first. So tomorrow, we're going to start with the first task in TG, which is this one. We're going to go in page-wise. Page. We will tell you tomorrow, we're going to start from page 1 in TG until page 78. For how long? In the whole week. And that's the reason why we started the course early. We started the course early because we want to give you more time. Dr. Afrin, I miss you. I miss you too, Dr. Afrin, very much. You know what? I'm thinking now to make the our previous candidates for the previous course to join this course too. What do you think, Dr. Afrin, about this? I miss you guys too very much. Dr. Arshner here as well. Wow. Guys, imagine our September candidates still here. Who guys from September? Wow. Dr. D. Tamish is here as well. Dr. Arshner. I love you guys. Okay. Yes. We will attend, guys, the class again. Okay. Guys, we don't need to be emotional now, okay? Let's focus on these people right now. Just to give them the plan, everything. Now, okay. So we're gonna start, guys, for a whole week for only 78 pages. from TG. Then we tell you exactly the important points you need to read. You need to read the principles of diagnosis and management in dental practice. Do we just only tell you to read it? No. We actually, what we do is, we give you notes. Like here. And then also the tricks, what exactly you need to do. We tell you about the clusters. Cluster 1, cluster 2, cluster 3, what exactly you need to read. What you need to look after. Numbers, figures, statistics, ratio, and percentage is very important in TG. Pharmacological part, we're telling you what exactly you need to know. Read this part. You're going to get at least 2 questions in exam from this part. Believe me. You're going to get in this part another 1 question. Ask the previous candidates at any year. They will tell you yes. Right? So, they think very important. How long, guys, it takes you to finish? How many pages? 4 pages. How long takes you to finish 4 pages? I don't think, not more than 30 minutes, right? Now, this is a plan. This again, recordings, like this is a video, that's recordings. We give it to you. Right? So now, we're not just only giving you some written materials or the daily plans only for a week time. We provide you with recordings. You hear these recordings, and then if taken from my time, it's more like I'm doing in love for everyone else. Who can I tell? Okay, guys, this type of recordings. Now, is this everything for the week? No, we give you cakes. What does it mean? Cakes, diamonds, and bites, all about my dreams in dentistry and ADC exam. I've always been dreaming all my life to make things simple and easy to our candidates and to provide them with cakes. When was the last time I provided my first diamonds ever? 3 years ago. Now, let's talk about the cakes. Look at this. Everything you need to know about dental caries. You don't need to open any more books anymore about dental caries with ICDAS. However, it's your right, it's your preference. We still give you books. We still give you some study materials if you really want to go through them. But the only required study materials, everything about dental caries, you will find it here. Every single small details for the exam purpose, you will find it here. Now, why we talk about caries? Because in the first 80 or 78 pages of TG about dental caries, about perio, about antibiotics, and the clusters. Because if you open the first few pages, you will find TG discuss things about the clusters, information gathering, history, diagnosis, management, treatment. So that's why we help you to understand TG in a better way, going through this type of material. And by the way, in exam, I believe September exam, they got question from this article, or actually from these cakes. The first one, information gathering. Then I provide the same with diagnosis and then treatment clusters. Why I'm giving you this? To make it easy for you, and because that's what we're going actually to discuss in this week. Perio. Everything about perio. 43 pages, very simple pages, very simple article, not articles, cakes. Why it's called cake? Because sweet. It's actually sweet like cakes, easy to digest like cake. That's why we call it cakes. By the way, September exam, March exam, whatever exams, they got these questions. They must get these questions from here. Any previous exam, they must get these topics. What type of X-ray need to use in perio cases, and why OPG, why bite wing, and all this stuff. It does have all the periodontal disease conditions. The chart. If you struggle with a chart, you will learn the chart. Because in exam, most popularly, you get the chart in exam. If you don't know today, I have asked question. What is the most important? That's my question. What is the most important clinical findings in 17-year-old to distinguish between gingivitis and periodontitis? Is it pocket depth or attachment loss of bone resorption? My previous champions, I believe now if you ask Dr. Didi Tamish or Dr. Arshinor, right, or all of my previous champions, they will answer the right answer. The new candidate, they may struggle it, but don't worry. Later on, you will be able to do it. You will be proud of yourself. So guys, now we're going to provide you all this stuff, very easy things to understand. And then all the lesions here, periodontal disease will be here. Application, advanced periodontal channel, limitation, frequency, everything required. Chronic periodontitis, aggressive periodontitis, aggressive gingivitis. Believe me, you're going to get whole scenarios about these topics. KEL, the new classification, you must get something about it. You must. Otherwise, if you don't know this stuff, you cannot be a dentist. Right? So that's, guys, what we do. We give you the plan, read the plan, which is this one. Daily plan for a week time, 7 days. We're going to start it by tomorrow. You go through it. Then know exactly what you need to read, page 1 to 8. This is about diagnosis and management. It means side to side. You need to read the cake. Mostly the clusters, because we're talking the first 8 pages about clusters. Then, again, the second part of the plan is prescription. You will find there is diamond for prescription. And then practical information using drug dentistry. Again, pharma, dental caries. You have seen the dental caries. Read it. Side to side TG. Do you want my advice? Read TG. The diamonds together, side by side. If you see any extra information TG, just you can transfer it to the diamonds. Because diamonds has more information collected in all our policies in Australia and the concepts in Australia, not just TG only, and the topics more than TG. Same exactly with dental caries and fluoride and periodontal disease. So we help you with this stuff. And then we provide you with all the cases, and then side to side. Day 2, you need to read page number 9 to 14 with case number 3 in order. Why? Because most properly we talk about pharma. There's 2 things talking about drugs and pharma. Now, day 4, which most probably will be on Tuesday, will be on Sunday, I believe. In this case, you need to read ICDAS. You will find the ICDAS nicely simplified in dental care's cake and with TG, and in other cases, you will see case number 1, the first case ever. Read it, plus TG, plus ICDAS, and then any extra information, put it in diamonds. All together. Believe me, you will not find any extra information, but just in case. If you find any extra information in ODL, or in TG, or in ICDAS, just add it up in cakes. Guys, am I clear so far about the plan? So now let's take this again. I will repeat this again, but please, guys, if it's clear to you, let me know. Otherwise, I'm happy to repeat again. From tomorrow, you will be added to this plan, which is the first stage, which is the warming up stage, or we call it the scratch stage, which is TG. Then you need to go with the first TG task only. Only first TG task. Don't worry about the second, third for this week. Then you read the plan first. Open TG from page 1 to page 8 for the first day. In the same time, you go to the diamonds and cakes and read the cluster side to side. You're lucky. In the first day, don't have any other cases to read. And then you will find there is the handbook. I give it to you. You don't need to read it all. You never ever. You can read Dr. Cameron book in one go, but chapter 1 only, you can read it. Read it. Dr. Paul Abbott, we gave you that chapter. 11, 12, 13, 14, 15, 16, 17 only. You know how many pages they are? Every chapter about 2 pages. Look at this. This is 1 page only. 11 and 12, 1 page. 13, 2 pages. 14, 3 pages chapter. Very small things. We give it to you. Then you done. First day, second day, third day. Then after this, you know what we'll do? We're going to have our mock. Exam mock. We will discuss the mock live. This is actually, again, recordings for the mock. But before the recordings, right, we're going to discuss it right now. Not now, I mean like in the next session. We give you this mock. Is this the only mock we have? No. Look at this. Let's go to Alpha Genius. We provide you with Alpha Genius, right? Alpha Genius, it has mocks in it as well. Not just only one mock. It has mock for every single subject and topic. Alpha Genius, for Prosto, for TG, for professionalism. Now, once we do this for you, you open the Alpha Genius for TG, and then you can actually practice more. Is this everything? No. We provide you mock in every day. Our tutors, Dr. Ann and Dr. Kim, they are the best ever. Dr. Ann Guy, she's a tutor now for more than 4 years. Everyone just follow us. They just start to get tutors only now. We have them 4 years ago. Dr. Ken is about now 2 years, right? Now they always with you. They understand very well. They haven't studied only yesterday or only the first batch for them. Then they will be next to you, give you mocks, daily mocks questions. We provide mocks as well on daily basis in my page, in my group. Let's have a look at this perfect app. Because the side to side you're going to do, you need to read the diamonds, you need to read the cakes, the plan in the first things ever with TG and Odell. Then Alpha Genius mock, Alpha Genius questions. Okay. Let's start, for example. This is, I believe, the TG mock. What you gonna do? What you can find this in this mock? 70 questions paper, exactly like ADC exam. Your paper in ADC, 70 questions. For how long? 2 hours. That's for 2 hours. Then, under the same circumstances, with very similar concepts, questions, ideas, critical thinking, you now, after you read TG for the first task or second task, after we discuss the mock together, the live mock, which will be the next session, in this case, what you need to do is, you now test yourself with Alpha Genius mock. This is the last mock you need to test yourself at this stage. And then you answer. What do you think, guys, the right answer here? Let's say you are examining a 2-year-old child with visible white spots, like these spots, lesions. The mother reports frequent milk bottle use and the occasional brushing. Seems like hygiene not good, and they have issue with food. Child drinks unfluoridated bottled water, means the teeth are weak, easy to get damage, and the family lives in a rural area without easy access to dental service. Question 1. What is the primary cause of child white spot lesion? Poor oral hygiene, plaque formed, genetic predisposition, lack of regular dental checkup. What do you think is the right answer? Poor oral hygiene practice, plaque formed by the frequent night time bottle feeding, or genetic. Let's say choosing any answer, B or C or D or anything. Let's say anything. Okay, I will just follow. Dr. Simran answer. Dr. Simran mentioned C. Okay? C. And then you check your answer. Wow, perfect, right answer. And then the good thing about this is, you're not going only to learn about your right answer. This Alpha Genius will provide you with at least 5 concepts in every question. The first concept, the right concept, A, unfluoridated bottled water. It's a contributing factor, but not the direct cause. Ah, wow, now I knew now this. Unfluoridated bottled water is a contributing factor. From where this answer came? Let's do something even interesting. Let's double this, duplicate it. Go back again to diamonds. All the cakes. Dental caries, because this question, dental caries. Look at the first chart. You see, guys, how things simple and easy if you read it. You will know the answer. I know some of you answered B, bravo, okay? Look at this. The answer is in this chart. Okay, guys, I think it's just still opening. Okay, you will find the chart. Let's just give it some time to open. Back again here. B Bravo contributes to progression, but is secondary to sugar environment caused by nighttime feedings. C, correct answer. The prolonged exposure to sugar during sleep promotes demineralization. Now, sugar is what? Sugar is food. Do I really need food to get caries? Yes. Without food, you never get caries. Without plaque, you never get caries. Without tooth, you never get caries. Guys, am I audible to everyone? Guys, am I audible to everyone? Okay, that's great then. Then, let's say if you don't have time, and you want to finish all this exam to learn the concepts rather than the questions. Now you finish it, and then you're gonna get with all questions and all answers, one by one, with all concepts. Okay, great. So far, then we move to TG second task, TG third task, and then until we finish all TG. Once we finish the scratch stage, as you see right now, guys, by the way, that's the one I was showing you. For dental caries, you must have a tooth, time, bacteria, and diet. That's why diet was actually the right answer, not the fluoride. Fluoride comes later on, but diet first. This 4 circles, which is blue in color, comes first. Now, let's say we actually finished the scratch or the warming up stage. Well, after this, we'll start right now with the second stage, which is a comprehensive course. In comprehensive course, we go with everything. Prosthodontics, periodontics, X-ray, restorative, endodontics, pedo, ortho, infection control, community health. Great. Now, we'll follow the same strategy. Daily plan with every subject of this. Then we give you diamonds to read it side to side. Then our help in Telegram groups. including me, Dr. Ann, Dr. Kim, Dr. Sam. And then we do our sessions mostly. You know what? Mostly, I have session every night. For you, next session will be on Monday, because normally my sessions on Monday and Wednesdays. That's my session with Dr. N. Will be different times, which is normally will be Tuesday and every day after my session. For example, if I do Monday, Dr. N do Tuesday. If I do Wednesday, Dr. N do Thursday. Why this? Because she takes you toward the study materials, takes you through the plans, and to ensure every one of you follow the plans on the right way. If you still have any issue with the plans, she will be supporting you during the session or during or in any time in Telegram group. Let's say we finish this stage as well. By the way, mock exam for every single subject of this. We have mock every day. Then the first revision. We do the first revision once, then the second revision one more time, and then the third revision. By the way, guys, this has happened for the previous course. This time, we're gonna add one more revision stage. Now, let's say, if you couldn't do good in the first stage, which is the scratch, don't worry, because we're gonna discuss TG again in comprehensive course. Let's say you couldn't join the course in comprehensive. In this case, we're gonna go with revision, the first revision stage. Okay, you've been busy, you have no time. That's fine. Second revision stage then, please do some work. No, I couldn't. Okay, you still have a chance in the third revision stage. Doctor, I only have like few weeks left for the exam. Can I do only the flash revision? Could be, but I don't recommend. Because this stage will take, every stage of this, it takes about 2 to 4 weeks. For example, the woman, the scratch, it will take 3 weeks. The comprehensive, it will take 3 weeks as well. The first revision, a month. Second revision, a month. Third revision, a month. Flash, it was about 7 days plan. Flash. Now, this is how it is gonna work. So, if you couldn't start or read, I'm not saying this to be lazy. I'm saying this to tell you how much we're gonna revise, how much you go in actually, how many you go in to go through the study materials, and you're going to enjoy. Even if you don't remember in the first time, you will remember and memorize it second time. If not, will be the third time. And the things made me to do this stuff. Let me just do something here right now. Guys, am I audible? By the way, how does it sound to you, the plan right now, guys? Okay. We discussed the stages. I believe everyone aware about the stages right now. You are now aware about the scratch stage. I will just go through this quickly. We start from scratch. That's for everyone who's busy at work. For everyone has a family. For overseas graduate candidates or students, they don't understand about the system in Australia. They have a long gap in their own study. As you see, we take you step by step. for the basics. No stress. We give you 3 weeks time. Every task for a whole week. That's why, again, we started early this time. You see, we start early, study smart, and stay relaxed. In this case, you'll be more confident, you have a more balance, and more success. As we discussed before, you're gonna get, now I think these things, it should be easy for you to understand. We start with TG. We give you the daily study plan. You understand what this right now. We give you the class explanation, which is related to TG. We divide TG into 3 main tasks. You understand it right now, I believe. We give you study notes, which is diamonds, cakes. We give you mocks. Every day there is a mock. My sessions with you, my discussion is a mock. Alpha Genius is a mock. As you see, Telegram quiz, we give you every day, Telegram quiz. Facebook mocks every day, mocks archive. Ooh, mocks archive. Look at that, guys, was actually great. The mock archive. The mock archive, it's completely different than the Alpha Genius. Alpha Genius has all the stuff in it. Alpha Genius mock, 70 questions. Prosonics, 70 questions. Community, 70 questions. Predonics, 70 questions. Professionalism, persuasion, every single 70 questions. As a complete paper. What about the archive? Completely different mocks. How many mocks there are? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. About 12 mocks. Again, these mocks actually has been given to the candidates, right, in the previous, I would say, 3 months. So in this case, you can open any mock of this. Start. It has all the questions. You answer any, like you see. You answer. That's right answer. Keep going. That's by luck right answer. Anyway, that's the wrong answer. It does tell you that's wrong. The right answer is this. Now, we finish this one too, right? Next previous, no, I need to finish. Now, another mock. Write the same thing. So you go all the stuff as mocks. By the way, guys, have you tried to download the app? Let me just do something here first with guys. Guys, please, guys, download the app. Please add me if you can't send the link for the app because it has free materials in it. You can use it if you know our candidates. We give you free access sometimes. Okay. What else you can get in our app? Bidu's brain. Look, today I was going through the Bidu brain and I asked question. Just from nowhere today. This is just before I start. Look at this. How do you restore a dark anterior tooth for 4-year-old child? That's, guys, my brain, by the way. I took my brain out of my head and I left it here for you because all this information based on my brain. My brain built up by the Australian dentistry. Australian dentistry built up by policies and guidelines. Look at the nice answer. A 4-year-old child. This is my question. How would you restore a dark anterior tooth for 4 years old child? Any question, guys, you have in this life, put it here in Pedobrain. They give you the same concept as ADC, the same concept as in Australia. And this is the right concept. For a 4-year-old child with a dark anterior tooth, the treatment depends on the cause and condition, definitely. Because if it is just because of trauma and internal hemorrhage, definitely you don't need to do pulpectomy. That's why it mentioned depends on the cause and condition of the tooth. If there is periapical pathology, very important information. What does it mean? You cannot decide on pulp necrosis without having at least one sign and one symptoms. One good sign for you is periapical pathology. Look, guys, at this perfect, easy, nice information. If there is periapical pathology, the preferred treatment is pulpectomy. Why? Because definitely there is necrosis. After that, restoring the tooth with conservatively is ideal. Now, is this everything? No, they're going to give you more nicer information to cover all the questions for you in exam. Since the child is young, the restoration should be both function and static. According to the references, composite restoration or veneers are commonly used for anterior teeth, but for a very young child, 4-year-old, a direct composite buildup is, which, believe me, guys, that can be ADC exam question. Easily, this part. This part easily can be ADC exam question. This part easily can be ADC exam question. Buildup is usually practical and minimum invasive, direct composite buildup. If the discoloration is due to trauma or necrosis, internal bleaching is generally not recommended at this age. Yes, again, that's another question. Imagine 1, 2, 3, 4, 5, 6, 5 to 6 lines. I swear, easily can be 3, 4 questions in exam. I swear. Why? Because this bit of brain works by me. It's my brain. I know exactly what type of information I need to provide you. I never shower you with any information. Ask any question here. It will give you the right answer. Even I was asking even before this about, maybe that's from the last time. Anyway, you can try it on your own. You will be in the course and then try it on your own. Is this everything in the app? No, we have lots in the app. Bedo's Brain, Alpha Genius, Mock Archive, all our recordings. We have the recordings, the new and old recordings. Look at this. Now, you know what? Easy. You want to understand about prosto? Open this. Right? You will find everything about prosto in this lecture. Please, guys, download the app for our champions. Let me share the screen again. Guys, how are things so far? I believe you understood right now about the MOX archive, about the website. Yes, we have a website. The Academy will give you the website and register you. We have an app. We show it to you. Google Drive. We show it to you. Every single subject and concept will be managed in the many stages. I want to show it to you. Bedo bytes. You know, guys, what is Bedo bytes? Let's jump here to this part. The new things first. The new things we're going to do for you, we call it the new or the surprises. Definitely, that is routine stuff we do at every course. The new questions, the new topics, and new concept. That is routine stuff. We don't consider it as a surprise, but just the new things we do. Bedo math. I used it before to provide Bedo math verbally. This time, I will provide Bedo math in written form. Definitely the champions from September, if we have, I believe we have few of them here right now that attend the sessions, they know this, they say, doctor, you should have done this for us as well, right? But every time we do something new for every course, like iPhone, for example. In the first instance, iPhone doesn't have that good camera, but after some times, with more thoughts, now we're getting into better cameras, for example. We do math, guys, something like this. Dentistry for me, because I love math and I love physics and I love dentistry. Dentistry for me is simple and easy, exactly like 1 plus 1 equal 2. And I believe it's going to be for you as well, guys. Now, read this few lines here. Read these few lines. It's a paragraph. Intra-oral infections are generally classified as localized, where the problem is confined to the tooth or nearby tissues, and the presence with pain, swelling, or pus discharge, and spread infections, where the infection extends into the adjacent spaces and may cause diffuse swelling, trismus, fever, or malaise, whatever, all this stuff, right? Antibiotics are not usually necessary for a simple localized abscess. However, they're justified if the infection is spreading, if the patient mucobiosis senses this, the patient has a high risk and rapid progression systemic complication. Do you know what? All this paragraph can be easily 1 beta byte. Guys, our September champions, guys, can you give me 1 beta byte for this paragraph? So you never ever can forget it in the past? Sorry, in the future? 1 beta byte, 1 beta math in this. Beta bytes, instead they are about 1, 2, 3, 4, 5, 6, 7, 8, 9, about 10 lines. Beta bytes are gonna make it only 2 lines. No, guys, 1 beta math about this? Make me happy, my champions. Okay. The most important part here about this, which is the last message, is the antibiotics. Wow, look at this, guys. Look, guys, our champions. Look, did damage. Antibiotic prophylaxis bidomet. I haven't showed to you yet, right? They knew exactly. I love this. You're a magician then, Dr. Didi Damish? Yes. That's a one. If there's enteral infections, and then the patient is profoundly immunocompromised, equal to antibiotics. What does it mean? We don't provide, the whole paragraph was about this part. You don't need actually to provide antibiotics for every single case of infection. But there's some conditions. If there is enteral infection plus patient's profound immunocompromised means now you need to provide antibiotic. That's 1 beta math. Now I give you lots of this, just memorize it, understand, you'll be perfect in the tasks. ADC exam will be simple like this. Okay. What else? Last course we did about 3 revision stages. This time will be 4 to 5 revisions to make you guys really strong. Now we're going to dedicate things for you. Health promotion. If you remember, let me now share this again. Right? We actually have health promotion as an integrated, a separate, personalized folder in the main course. We're going to make it more extensive and we're going to focus more in it because we knew now it's very important. Same exactly with topics like smoking and all the stuff. We discussed about smoking, definitely, in our previous course, but this time we're gonna put more lights and we're gonna highlight more into these topics. For me, I'm very excited about this stuff, making things easy for you. Bedo's brain, I already explained it. Alpha mock archive, I already explained it to you. Perfect. I love the alpha mock archive and the alpha mock exam. I show it to you, something different. And now by this time, I believe you're aware about it. Alpha genius, I show it to you. And I believe by now, you understand it. Bedo brain, I show it to you. Recording sessions, I show it to you. Facebook activity. I love Facebook and I love Telegram, but I love Facebook more. You will know this about me. Right? We give, you see now, Dr. Al-Haq saying, Dr. Bidu, can you please help us with solving audit cases? Look at this. Free session on TG, ICG, and audit cases. Definitely, we happy to do this. Please, guys, ensure attend the session. Bidu Bytes explain to you. Personalized study plans, yes, that's what they're going to do for this course. I give you an example of Bidu Math, rating Bidu Math. Guys, these are the Alpha app, ensure, and the website, ensure registered there. Now, our sessions, guys, at 8 p.m. Sydney time, sometimes 7. So at any time, 7 or 8 p.m. Sydney time, we start our classes. My classes will be on Monday and Wednesday. Dr. Ann classes will be on Tuesday to explain to you more about the plans, take you through the plans nicely. And if you have any issue with them, read the articles with you, read the books with you. If there's any books need to be read, or the Bidu Bytes, which is very easy and simple. However, if you still have any issue in this, definitely she will be helping you all this stuff. Take you, guys, I'm telling you, we know, well, I don't call it as we spoon feeding you, nope. But we call it as we hold your hand, because I always say, you are our family. And by the way, that's my word. People use it right now. And I'm proud they use my words. They can take it. Right? So we always consider you as a family members. That's since long time. We are always the candidates for me family members. Now, tomorrow, you will get an access to the Google Drive. Then you will get the plan. By the way, guys, do you know I do no fees sessions, right? Like here, like this one. No fees, free sessions, right? Would you like to have sessions this week? Do you have an extra session this week? Because our next session will be on Monday. Would you like to have any session? Because we're going to do mock exam as well soon. Mock exam will be this week. But apart from the mock exam, because that's a simple thing, mock exam, would you like to have even more sessions about TG itself? The TG topics? Dr. D Damish say yes. You should have rest now, Dr. D Damish. Okay, that is good then. So you know what? We go ensure first that you have registered your name on the post. I already made it on my Facebook group or our Facebook group. Please, admin, if you can share this link here to everyone, so they ensure they join there to get the link for the fees, no fees session. And then we'll have a session about TG. And you know what? Look, guys, just now I got good plan for you. Tell me, guys, how you feel about this plan. What if we can follow the first TG task all together on the Facebook group? Then we do a mock exam only focused on this task only. How does it sound to you? Yes, new TG topics, yes. Guys, did you get my idea right now? On the Facebook, we're gonna do this, guys, on the Facebook, on my group. Please, guys, Dr. Martina has shared the link with you right now. For our Facebook group, ensure you are there. And then what we're going to do is for this week, right? We going for our champions. Definitely they're going. But by the way, I'm not sharing video bytes. I'm not sharing all the stuff for free. This is only for our champions. But to help you guys somehow, I will do one session to discuss about these important topics from TG. Then after we finish this pages, which is 80 pages. Now, guys, our plan for everyone here, everyone listen to me right now, either on Zoom or on Facebook, right? Everyone, start now with TG version 3. That's the one right now with everyone. That's the latest. Don't confuse yourself. TG version 3. The first 80 pages. Ensure you registered your name under the post I made it on my Facebook group or our Facebook group, the Pediatrics group. Then you will attend the session which I explain this 80 pages, the most important point in this 80 pages. Then we'll do a mock only cover this 80 pages. Now test yourself. Okay? How, guys, does it sound to you? Good plan? That's very good then. I'm just writing down my notes, guys. Okay. Now let's, guys, take your questions. Please, guys, if you have any question for me, I'm very happy. Take your question right now. Okay, the first question. I'm very happy, Dr. Ibrahim, you really like it. Question session, we can do question session as well. Yes, 80 pages, please, Dr. Faiz, yes. No, Dr. Jaylan, TG version 3. TG version 3. How many chapters, Dr. Faiz? I believe it will be until Peru. Carries Peru, maybe 4. Dr. Rand, very tricky question. Oh, yeah. You want the answer for this very tricky question? I will tell you now. Dr. Bidi, could you please share the roadmap after clearing ADC part 1 for part 2? Yes, doctor, we're going to do a separate session about this, Dr. Shiva. Dr. Ashwani, ask question. Dr. Bidu, you mentioned there will be a mock on the first 80 pages. Yes. Is that correct or did I miss? Yes, there is going to be 3 mocks in the first 80 pages. 1, our private mock with our candidates only, and this will be discussed on Monday. 2, Alpha Genius mock. You will answer it by yourself as a test, and then that's a 70 question mock in 2 hours. It has all the explanation and answers. And then 3 will be a public mock for everyone. Doctor, by when do we have to complete reading 80 pages? 1 week, 7 days plan. This is already mentioned in the plan. It will be easy when you look at it. Yes, Dr. Maria. Dr. Bido, when will be the next TG session and mock? Will be this week. I will be missing you, Dr. Didi Damish. No problem, Dr. Fitz. Yes, Dr. Amita. Dr. Sayeda. So we have to complete 80 pages and then will be the mock for that. Yes. And will be exclusive for the 80 pages. Yes. Dr. Sana, I want to join. Can I get discount? Yes, Dr. Sana. Please, admin, can you please reply, Dr. Sana, please, admins? Give Dr. Sana, please, the link. Dr. Sayeda. So we have to complete 80 pages, yes. Dr. Teresa, working full-time doctor. What if I couldn't finish the 80 TG pages? That's okay, because the way I explained to you how the course is going to be, we're going to discuss TG again in the comprehensive course. And then we're going to discuss it again in the first revision and second revision, third revision. So if you're not able to, if you, for example, only cover 60 pages or maybe 60%, that's okay. Whatever left over, leave it for now, because that's maybe comes under dental cares. We'll cover dental cares again and restorative or operative topic in the main course, or that can be comes under perio, because 80 pages has caries, fluoride, and perio. So we're gonna have a separate cases and separate sessions and separate part for perio, and then that's a comprehensive course. So we repeat again TZ in this part. So don't worry, you're gonna cover it again. Easy. No problem at all, Dr. Ashwani. Dr. Sahifa, do we have to finish the poll? No, not all. Try to do your best in them, because anyway, I have video bites in this stuff. We have cakes side to side. Just read it quickly, scan it quickly. While you read the video bites in the same topics, you'll be things very easy for you. Dr. Al-Haq, Dr. Bido, Dr. Bido, there was a few Facebook groups with your name, and it is bit confusing. Can you please confirm which one part 1 students should follow? Okay, the one which is part 1 should follow, it's called the Pediators group. I believe it should be ADC part 1, March 2026. Help the Pediators group. Can you please, admin, please reply to Dr. Al-Haq comments to know which group it is, please, Facebook group. Dr. Mylene, we will discuss all the topics, any new topic, in any new book. We actually discuss it, especially TG. So yes. Doctor, the TG version, 3 has a clown face. Yes, that's a 1. You're totally right, Dr. Fatima. Oh, wow, Dr. Vijay, guys, I like you very much, guys. Dr. Vijay, she was our September candidate. I have seen the amazing features of Alpha Genius, the mock exam, the mock archive. And oh, thank you, Dr. Vijay. I wish you all the best in your result. I love to hear this, Dr. Vijay. I love guys to see even September champions. They actually attending the course, attended my sessions. I love to know that. You know, guys, you honestly my motivation. I never seen this in my life. Even after you finish the course, after do the exam and everything, they still here. It happens before many times, but I mean like no necessity to happen in courses like this. Dr. Jailan, the one which have clown. Yes, that's the one, Dr. Jailan. Yes. Mock exam will be on next Wednesday. Yes, Dr. Faiz, because about Wednesday. Yes, because we need about a week. Yes. Dr. Harpreet saying you are amazing, Dr. Bido. You are the best, Doctor. Dr. Harpreet, thank you very much for saying this. You are the best, Doctor. I love to hear this from you. Thank you very much for saying this. I really appreciate it. Let me do something as well. Okay. Okay, sorry guys, I'm reading your comments and your questions. Sorry guys for this. Give me a second. Yes, that is a much better way. Why I didn't do this from the beginning? Guys, can you see my screen right now? I should have done this from the beginning. I miss you, Dr. Veer. Yes, Telegram group Dr. Veer is only for enrolled candidates. You know, you are from September, so you know this. Okay, guys, let me check more questions. Please, guys, send the Facebook part 1 group to Dr. Tanvi, please. Yes, TG therapeutic guidelines. You're right. I believe so, Dr. Teresa. TG, it's for therapeutic guidelines, Dr. Ibrahim, and ICG for infection control guidelines. You know what? You're totally right. I'm always get confused with this stuff. You're totally right. Even me, if someone give me any abbreviation, I normally don't know what is this abbreviation, unless I really had good experience with it. Dr. Alifia, which is the same Dr. Alifia we have in our Dr. Alifia, everyone knows here. How can I have access to MOX and the Bido Brain, Bido Byte, and also the materials on Alpha Genius app? I am already enrolled. Yes, please, Dr. Alifia. Please, admin, can you please help Dr. Alifia? Please, admin, if possible. Please, Dr. Alifia, for now, just send a message on our official Facebook page to our admin. They will help you in this, take you slowly toward them, explain to you more. Otherwise, I believe they will reply you right now here with the link, and then they will definitely help you. Next week, Dr. Tanvir. Thank you very much, Dr. Ahmad Sami. Thank you very much. Thank you, Dr. Harpreet. I really love this from you. You're amazing. Thank you. I hope, guys, I didn't miss any of your question. Please, if I missed any of your question. Yes, Dr. Anum. Can anybody confirm 80 pages just of TG or meanwhile any other book? Mainly from TG, and then follow the plan for us, Dr. Anum, please. The plan will be shared with you tomorrow. Then you can follow the plan. It will give you everything. Everything there will be mentioned. Okay? With video bites and everything will help you toward all the stuff. Dr. Ray, hi, sir. Is the first mock test is just for TG 80 pages? Yes, Dr. Ray. But please ensure for no fees mock, please ensure you click on this link here, right? I'm not quite sure this link or different link. Please ensure, guys, this is the link for the Facebook, for my Facebook, for TG. Please, Dr. Adam Part 1, ensure this link. It's actually for our page, for our My Pediatrics group. Dr. Ashish. Hi, Dr. Bid. Hi, Dr. Bidu. How should we touch base with for repeat candidate access or registration? Thank you. Dr. Ashish, definitely will be through the academy. Please, guys, if I wish if I have the link with me, Dr. Ashish, I'll give it to you right now. You know what? I will send it to you private after the session, Dr. Ashish. No problem. And by the way, I'm very happy seeing here, Dr. Ashish, back. I was thinking about you many times, by the way. Okay, where can we find infection control guidelines? It's in just write down on Google right now, Dr. Gilan, on Google, write down EDA infection control guideline, the latest version. Now in Google, you will find it straight away. Dr. Tanvir, thank you very much, Dr. Tanvir. Sarah, I love the way you taught prosthodontics lectures in September batch. Since then, I fall in love with your way of teaching. Thank you very much, Dr. Tanvir. It's my pleasure. I'm always happy to help you, doctor. Sir, RG Public Mock, yes, will be available next week by the end. Yes, yes, Dr. Tanvir. Yes, to TG, yes. I know it's TG, yes. I am already enrolled, Dr. Faiz, yes. I'm already enrolled and don't have anything in my alpha. Can you please check that you actually apply the same email address? Because sometimes what happens is, look, this is the most common, but not necessary to be the same reason, but that's the most common we found. For example, you give the team an email address, and then when you use different email address, and that's why it will not be linked to Alphab. However, the easiest way is just to check with our team right now. Send them a message, right? Send the message and ask them about to add you back again to it, please. Or maybe you can. What you can do also is try for a time. If you can delete the app and download it again, I think that's may sort the problem sometimes. Thank you, Dr. Anum. No problem. Thank you, Dr. Ashish. And I'm sure we'll be meeting you again in Sydney. Eva? There's Eva and Adam. I am Adam. So now I'm looking for Eva. Dr. Gilan. I'm not sure what is Eva exactly. Anyway, she's Eve, not Eva, but yeah. Can you repeat what shall I write in Google? ADA. A for alpha, D for delta, A for alpha, ADA, infection control guidelines, the latest version. Please, guys, if you can send the link here for Dr. Jaylan, will be good for him, be easy for him, please, guys. Yes, with Dr. Balija. Please check this with the Academy, and definitely they will do this, okay? I know, Dr. Alija, you enrolled to the course as well, because I can see your name from Telegram group as well. No problem at all, Dr. Faith. You are great, Dr. Anam, to help Dr. Jaylan. Yes, please. That's the one. It's called the ADA. Dr. Anam, just make it ADA. Okay, guys, I hope I answered every one of your question. From tomorrow, do we have to go through with ICG now? No, not actually, Dr. Aishika, no. If you have time, you can go through it. Otherwise, just follow the plans, okay? Okay, guys, I hope I have answered all your questions at this stage. I will be next to you in Facebook page, in our Facebook groups, on our Telegram groups. I will be during the session with you. We have 2 sessions every week. Dr. N will have 2 sessions with you. And I have another 1 or 2 sessions for, you know what, 7 sessions a week, guys, seems like we're gonna be, right? And no fee sessions. So guys, I was very happy to have all of you here today. And thank you very much. Thank you very much, Dr. Sahifa. It's my pleasure. Thank you very much, Dr. Sahifa. And thank you, every one of you guys. See you then on Monday in my session. And then will be, I believe, 1 no-fees program session this week. Okay? Thank you very much, Dr. Tanvir. Yes. Yes, Dr. Tanvir, yes. Thank you, Dr. Eshika, very much. I really appreciate this. No problem at all, Dr. Walija. It's my pleasure. Thank you. Thank you, Dr. Simran. Thank you very much, Dr. Shiva. It's my pleasure. I'm very happy, guys, seeing you here all of you. Thank you, Dr. Sajriti. It's a very nice name, Dr. Sajriti. Thank you very much. No problem at all, Dr. Faiz. It's my pleasure. Thank you very much, Dr. Faiz. It's my pleasure, Dr. Fatima. Thank you very much, Dr. Fatima. See you then in the classes, in the private classes. Thank you, Dr. Anam. See you then in the course. Good night to you. See you in Telegram, the private Telegram group. Thank you very much. Thank you, Dr. N. Thank you very much, Dr. N. It's my pleasure. Thank you, Dr. Alifia. It's my pleasure. Okay, guys, have a rest right now. From tomorrow, we start to enjoy the journey together. And I believe it will be a perfect journey with all success in it. Thank you very much, guys. Have a great night, every one of you. Thank you very much. Bye-bye. Bye. Okay, Dr. Bat, from where we can get ICG and other than soft copy? Soft copy, yeah, soft copy from online. From online. The links has been, Dr. Rand asked about the question. Sorry, Dr. Rand. Okay, guys, if you're still here, back again, guys, because this is a good, you know what? Okay, I will explain it here. I will even leave the answer there, okay? In a 70-year-old patient, what is the key difference between chronic gingivitis and active periodontitis? The answer is, see, Charlie, true pocket depth. For explanation, I will explain it in the post itself, okay? I will explain why it's true pocket depth, okay? No problem at all, Dr. Koshika. Thank you very much, Dr. Koshika. Thank you very much. Thank you, Dr. Saral. It's my pleasure. Thank you, Dr. Veer, very much. Thank you, Dr. Veer, very much. Okay, guys, see you then soon. Thank you, guys. Bye-bye. Bye. I don't want to leave, honestly, but that's okay. Everything has an end to it, right? Thank you, guys. Bye-bye. LA for controlled hypertensive, yes. You can give LA for controlled hypertensive even with adrenaline, no problem. The normal one, adrenaline, we can provide up to 27 micron of adrenaline per 1 carpool, maximum 2 carpools, which come up to 44 micron for adrenaline, yes. For a controlled diabetic patient, yes, no problem at all. I will explain this, Dr. G. Len, on the Facebook, okay? I will explain on the post itself why it's not carried, okay? Thank you very much, guys. Have a great night. See you then. Thank you very much. Thank you, Dr. Rand. Thank you, Dr. Veer. Thank you very much, guys. Bye-bye. Bye. Have a great night. Bye-bye.